to make sure.
Hello and welcome into this week's edition of AFMC TV. We're so glad you joined us. Today's first topic, boy, it's a doozy. We've got Rebecca Denniston in here, and we are talking about acne. And before we actually started rolling, we were kind of talking, this is a broad, large topic.
It is.
That we're going to tackle this morning.
Yes.
So why don't we start first in just genetics? How does genetics play a role in acne development?
Sure. So yes and no. So there's no specific gene per se that causes acne, but we do see a big kind of family correlation. So if your mom and dad have bad acne, a lot of times the child will have bad acne. So definitely I think there's a role. It's not always 100% true, but for sure that can be.
What about our diet? Diet isn't always the best. And so
Right.
Does that have an influence on acne? Could it influence?
Yes. So back, years ago, there was a lot of things that people talked about, chocolate and caffeine and fried foods, sugary foods, all these things that potentially could make your acne worse. But it's been fairly well studied, and there's nothing that definitively says, okay, you need to take this out of your diet so that your acne will clear. Dairy can have a small correlation, but it's not enough for us to say you need to stop eating all dairy for your acne to go away. Mm-hmm. So there's really not a definitive, food or drink that causes acne.
So are there different types of acne that teens may deal with and that adults may deal with as well? Yes,
definitely. So starting, I'd say probably around like 11 or 12 in females and in males, you do start to see acne. A lot of it is what we call comedonal acne, so smaller kind of whiteheads and blackheads. And then as you get older, females especially, you can see more hormonal acne. And then also in adults, there can be a hormonal acne. And those tend to be larger bumps, usually red, really tender, maybe deep under the skin. So there's definitely different types of acne, and those are oftentimes treated differently as well.
If you had a bad experience as a teen, does that then lend itself to having a not positive experience as an adult?
I definitely think that's the case. I see a lot of adults that might have had acne as a child or a teen, and then it got better and then it came back. And I think there's a lot more frustration as adults.
Sure.
I see a lot of adults coming in and they're like, well, why is my face breaking out? Why do I have acne?
Thought I was done with that.
Yeah, exactly. And so I'm seeing a lot of that, honestly, but there's great treatments out there and things that you can do now.
So let's talk about some of those treatments.
Sure. Yeah. So again, it depends on the type of acne. More for kids, teens, a lot of times we'll do retinoids. So tretinoin, which is the generic name for Retin-A. Retinoids work really well for acne in young adults and in older adults as well, but it works to increase your cell turnover. So you get rid of cells faster, you make new cells quicker, kind of helps keep those pores cleaned out, really helps with blackheads, and then also has benefit for scarring and pigmentation from acne. Oh, wow. So a lot of times we'll use that in both teens and adults. Sometimes we'll do other topical medicines with it, sometimes oral antibiotics. Older adults, it kind of depends on what the cause of acne is, but there's good hormonal treatment. So we have a pill you can take, and then now, as of probably 6 months ago, we have a new topical medicine for hormonal acne. And that's kind of a new thing for us. It's the first new class of acne medicine since about the 1980s for dermatology. So it's a big deal. And there's just all kinds of different things you can do. Males, I think, especially older males, older adult males, I do see, interestingly enough, correlation with testosterone. So that's a big thing right now. Testosterone injections are more popular, and those can cause acne, a lot of truncal acne, so chest and back. So that's a whole nother thing.
That's a whole nother episode.
Yeah, exactly.
Sure.
Yeah. So
So is there anything we can do to prevent outbreaks?
Definitely. I think especially for kids, teens, and even adults, if you're exercising, playing sports, you want to make sure you're really good about washing your face. That's the first step. So, you wash your face in the morning. If you exercise or sweat a lot, it's good to wash your face after that. And then at night before you go to bed, getting all that dirt, oil off throughout the day. And then for females, making sure you take off your makeup at night before you go to bed, getting that clean face is really important.
I heard someone once say, every time you brush your teeth, you need to wash your face.
Yes.
So in theory, if you're brushing your teeth in the morning and you're brushing before you go to bed at night,
Yes.
you should be washing your face in the morning, washing your face.
Yes, exactly. That is so very true. Yes, definitely.
If people, at what point does acne, whether it's in a adolescent, teen, and adult, at what point does it really necessitate some type of medical intervention? When should someone realize, we're past the point of dealing with this at home. Let's go to a dermatologist.
Yeah, I think there's kind of a twofold answer. So obviously, if it's bothering your child or your teen's self-esteem and it's really, affecting them, by all means, bring them in. There's things we can do. But sometimes the acne is just not bad enough yet, and there's some great things you can do over the counter. So benzoyl peroxide washes are a big thing that work really well for chest and back acne that kind of take the bacteria off the skin. And then a medicine called Differin, which is adapalene, and it has a retinol in it. And it actually used to be prescription, and now it's over the counter. And so let's say child, teen, adult is doing those things. So they may be doing their gentle cleanser, they may be doing a topical medicine over the counter like Differin, and they're not seeing results, then you would want to bring them in. Most acne treatments, I try to tell patients that it's going to take about 6 to 8 weeks to see changes. But, by all means, if it's really bothering, the child or even the adult, definitely come in because there's lots of options for treatment.
All right, great. And Rebecca, where can folks get a hold of you?
Yes, so Dermatology Group of Arkansas. We've got 6 locations, and happy to see you for your acne.
Okay.
So, yeah.
Becca, thanks so much.
Thank you.
JJ Mayo joins us now. JJ, we're talking salt.
Goodness, salt. Love it.
So one year we love it, the next year we hate it. One year it's going to kill us, the next year it's our best friend. Like, what is the deal?
Oh, let's talk about salt. That is a big topic, because there are millions of Americans that have high blood pressure. But when you look at salt, let's just take a step back. Basically, salt is, we think of sodium, but it's actually sodium chloride, right? It's like only 40% sodium and 60% chloride. And sodium is important. We need it for a lot of functions in our body. Things like muscle contraction and nerve conduction and fluid balance. And that's where we get into trouble sometimes with its effects on blood pressure. But, salt is really important. And another thing about salt is that, I don't know if users know, listeners know this, but it has iodine in it. So we have iodized salt. Just some of these salt, like I just brought one with it. You probably can't see it, but it says on there, and this one comes and tells you, but most of the table salt that we buy at the store, it's going to have some iodine, because what that does is it helps the thyroid. There's a condition called goiter that happens if you're low in iodine. So to solve that problem, they put it in salt, and it's in all kinds of different varieties that you can buy at the store. Yep.
So how much salt do we really need to be getting in our diet or on a daily basis?
That's the scary thing, right? We know it's important, but we just don't need that much of it. We need about 23 to 2,400 milligrams of salt. That's what they recommend. And even if you got high blood pressure, it might be less. How much is 2,300 milligrams? This is it. A teaspoon. It's not that much. A teaspoon of salt is all we really need. And so think about what we do when we go to our restaurants or even at home. And my parents were like this. They didn't even taste the food, and they're already putting salt on it because they just what they do. It's a habit, right? So we need about a teaspoon or less, and most of us get double, triple, or more than they need.
And is that a teaspoon or less a day?
Yes.
Yeah, that's going to be hard for some people to wrap their brains around.
Right. Yeah, it is. And so think about that the next time you are going to try to salt your food.
So when's a good time to start cutting back? And I guess maybe first, if you've never had a problem or never been told that you have high blood pressure or that you need to be concerned about salt, should it still be in the back of your mind how much you're consuming?
Absolutely, because that can lead, because essentially what happens is with people overdo salt over a long period of time, that when you have extra salt in your bloodstream, we know that salt kind of sucks in the water and pulls water with it, and it pulls it into that bloodstream, and that's what causes your blood pressure to be high, because there's more fluid volume there in the bloodstream. So that increases your pressure over time. I'm not going to do it overnight, but it will over time. And even if you do have normal blood pressure, right? It's not a problem. You still need to think about, okay, I don't need really that much, right? If I'm going to add some. So yeah, if you don't have a problem, you still need to have it in your back of the mind that you probably don't need it. You want to season your food, but you don't have to always do it with salt, right? You don't have to always just put salt on everything. And definitely if you do have high blood pressure, you want to cut it back best you can.
What are your thoughts on the salt substitutes? Are those good substitutes to be ingesting?
Yeah, I mean, they're okay. I mean, I would personally suggest that you do things like you season your foods with herbs and spices and some of these other options besides. There's a lot of, I enjoy pepper, so I pepper a lot of things, put pepper on my food, but there's all kinds of other seasonings and spices you can use without, and to make your food taste good, because that's what it's all about, besides putting salt on there. Yeah.
What are your thoughts? Because there are so many different varieties of salts on the market. You've got the Morton salt with the umbrella. You have sea salt and pink salt and Himalayan salt.
Yes.
And so is one better than the other? Or are they relatively all really salt is salt?
Yeah, I would pretty much tell people to save their money. I know you can buy the pink Himalayan organic salt, whatever. You can buy that, and the Himalayan salt will have a few more minerals in them than like regular table salt, but you can get that from eating real food. So I would always suggest, get that from real food and save your money and just buy the regular table salt. I don't think you need anything fancy, in my opinion.
Is there ever a point where we need to just leave it alone, just leave salt alone, just forget it exists?
Yeah, I mean, because you try to limit it, because everything that you eat has salt in it almost. You don't think about it. One of the biggest offenders, I've got it right here, my old chunky soup. Right. I mean, you think about the soups and the gravies and the condiments and everything that we consume is going to have. And one of the reasons is because it increases the shelf life. Right. It increases it. This thing could sit on the shelf for a good while. But that's why they do that. Right. It definitely it maybe adds flavor, but it increases shelf life.
I once heard a nutritionist say, if you are looking on the back of a can, if you are reading those labels and you look at the back of the can and the sodium, there's more sodium than what there are calories, you need to put that can back up on the shelf, because you do not need to be putting that in your body.
Well, that's a great, I like that, because if you look, I'm just looking, my eyes are pretty bad. One, because there are two cups in this can, and there's almost 800 milligrams of sodium in one serving, right? So that's like 1,500. We said you only need that about 1,500 if you have high blood pressure. 23 you can get away with. So there's a lot in a can of soup.
And using that can of soup, how many? Only pour half the can in a bowl. Yeah. Generally, you dump the entire thing in.
Absolutely.
So,
yeah. The soups, the gravies, the condiments, the what else? The processed meats, anything that's processed. I guess that would be the recommendation. Is just eat real food and try to limit the processed foods, because those are the ones that are going to be have that extra sodium and salt in it. So just be careful. Read the label. That's another good tip. It's just like we did, right? Read the label to actually see how much is in there, because you don't know until you read the label.
It's the more you know. All
Yep,
right,
yep,
JJ.
Yep. No, I like it.
Thank you for joining us today.
Yep. I appreciate it.
And thank you so much for joining us. We'll see you back here next week for more AFMC TV.